Hi guys, welcome to another section of our video. On today's episode, we're looking at Hsg and the instruments used for Hsg. You may be asked, what is Hsg? Hsg is a medical procedure or diagnostic examination carried out on women to assess the uterine cavity and the fallopian tubes. It is used to assess the size of the uterine cavity and also to check for patency on the fallopian tubes. Hsg stands for uterus, as we know, while Sapino stands for the fallopian tubes. So Hsg is the study of the uterus and the fallopian tubes. Hsg is usually carried out in cases of secondary infertility. If a lady has been trying to get pregnant and he'll be struggling to get pregnant and wants to get pregnant, the gynecologist will advise that the lady carry out Hsg procedure to see if the tubes are open or not, also to assess the size of the uterine cavity. Now also, there is timing for Hsg. As we know, Hsg is a special procedure, so it's not something you just wake up and carry it out. There's a special time for it depending on your menstrual cycle. So Hsg is done after your period and before ovulation. It's advisable it is to be done between the 8th to 10th day. Now the reason for that is so as to avoid the risk of the lady being pregnant, and also so as to avoid doing it with heavy bleeding. So that's why it is done after your period and before ovulation. Now, what's the procedure for Hsg? The patient will come and we change into the examination gown and we lie on the couch. Then after the preparation, a material will be inserted into the uterus, and as the material is moving, different X-ray images will be taken to assess the movement of this material, which we will talk about later. It's part of the equipment we'll be looking at, and also to check the movement of this material as it moves down. So now let's move to the instrument for Hsg. The first instrument we'll be looking at here is the contrast agent or dye. Now this is the major thing needed for Hsg. It is this dye that is inserted into the uterus, and as it is moving, X-ray images are taken to see if there will be blockage anywhere or not. Now they come in different forms and types. We have urographene, we have omnipec and others. This very one I'm holding here is omnipec. Now, another instrument we'll be looking at is the vaginal speculum. This is what I'm holding here, the vaginal speculum. Now, it is inserted into the vagina to open up the vagina so that the cervix can be visualized, so that we can see the cervix. You know, the cervix is the entrance to the uterus. So, if you want to carry out Hsg, you must visualize the cervix. So, you could do that with the help of the vaginal speculum. Another instrument we'll be looking at is the uterine sand. Now, the sand is introduced into the cervix to evaluate and assess the direction of the uterus, so as to know where the uterus is moving. So this is the uterine sand. Now another instrument looking at is the syringe. The syringe now is used to administer the contrast agent. You use it to draw the contrast agent, then administer it. Now another instrument we'll be looking at is the cannula. The cannula now is used to insert the contrast into the uterine cavity. So the cannula is fixed through the cervix into the uterus. Then with the help of the syringe now, the contrast agent is now pushed through the cannula into the uterine cavity. Now another instrument we're looking at is the forceps. So forceps is used to hold and clamp organs and tissues. Now another instrument we'll be looking at is the sponge holder. This is the sponge holder. Then we also have other instruments like cotton wool and the gauze. They are used for cleaning. So you use the sponge holder to hold the cotton wool, then you clean the lady up. Now another instrument that is sometimes used is the normal saline. This is the normal saline. Most times it's used to mix with the contrast agents. So if you are using some persons, if they are using the 20 ml syringe, what they will do is that they will take 10 ml of the contrast agent and 10 ml of the normal saline and mix it up before they introduce it. So those are some of the instruments used for Hsg. Those are the instruments with outline, the contrast agent, the vaginal speculum, the uterine sound, the forceps. So these instruments are used in Hsg. The reason for Hsg, like I said earlier, look at the size of the uterine cavity, and also to evaluate the patency of the tubes, the fallopian tubes, in cases of secondary infertility where a lady is trying to get pregnant. I'll beg us to subscribe to my channel, turn on the notification button so that subsequent videos you'll be notified. Please like and share. Thanks.